What tests do ERS use to diagnose severe flu cases? When you're feeling really sick and think you might need emergency care, doctors have a few key ways to figure out if the flu is the cause. They mainly use rapid tests and more precise lab methods to get an accurate diagnosis quickly. The first tool is called a rapid influenza diagnostic test. This test looks for pieces of the virus, called antigens, in a sample taken from your nose or throat. It can give results in about 15 to 30 minutes, which helps doctors decide right away if you need antiviral medicines or other treatments. But these rapid tests aren't perfect. They can sometimes miss infections, especially in severe cases, so a negative result doesn't always mean you don't have the flu. To get a more accurate picture, ERS often use molecular tests, especially polymerase chain reaction tests. These tests detect the virus's genetic material, specifically viral RNA, with very high accuracy, over 99%. Although PCR tests take longer to process, often a few hours, they are considered the most reliable way to confirm influenza, especially in serious or complicated cases. Because of their high sensitivity, they are very helpful when doctors need to be certain about the diagnosis. In addition to testing, doctors relying heavily on clinical assessment. They look at your symptoms like fever, cough, muscle aches, and how suddenly they appeared. If you have trouble breathing, chest pain, or signs of complications like pneumonia, the doctors will also perform imaging tests like chest X-rays to check for lung infections. Blood tests may be ordered to evaluate your organ function or detect secondary infections. Measuring your oxygen levels with a pulse oximeter helps determine if your lungs are delivering enough oxygen, which is crucial in severe cases. All these tests and assessments work together to help doctors quickly identify the flu and decide on the best course of action. Starting antiviral treatment early, ideally within the first 48 hours of symptoms, can make a big difference. Because symptoms alone aren't always specific enough, combining rapid tests with PCR and clinical judgment ensures the diagnosis is as accurate as possible. This comprehensive approach helps ensure you get the right care promptly, especially if you're at high risk for complications or showing severe symptoms. Always remember, if you're worried about your health, it's best to seek medical advice from healthcare professionals who can tailor the diagnosis and treatment to your specific needs.